Hi everybody, it's Dr. Wolf. I have a short video for you about the difference between clinical and subclinical, which is an important distinction we make before we start getting into some of the differences between the specific disorders that we'll cover this semester. So let's get started. So depending on your background, you may have already heard some of these terms: subclinical or subsyndromal or subthreshold, and clinical. So let's just talk for a second about what that means. So when we think about mental health diagnosis, every single one of the disorders that we'll cover in the DSM has a list of symptoms. And for every disorder, there's a certain percentage or minimum number of symptoms that you have to have for us, the clinician, to say, yes, you have this diagnosis, or yes, this seems to be the presenting concern, right? If you indeed have whatever is that minimum number, right, that is when we start talking about having a clinical situation or a diagnostic condition or diagnosable condition. It means that you've met whatever, again, is the minimum threshold to say that you actually have this condition. But for many people, and many people who visit therapy, their condition or their symptoms or their presenting concerns don't actually meet whatever is that minimum. And in those cases, we refer to that as subclinical, subthreshold, or subsyndromal. All of that, again, means below whatever is the minimum threshold for that diagnosis. For some diagnoses, the DSM also allows for what's called mild, moderate, and severe. Not all diagnoses or all conditions have this additional code, but some do. And usually there'll be very specific pieces of information, right, about how someone who's going to use this book for diagnostic reasons, could say that, oh, this person is subclinical, does not meet the threshold. This person does, but it would be considered mild. This person has this many symptoms, and so this would be considered moderate, or this person has this many symptoms, so it would be considered severe. You may have also heard the term worried well. And sometimes this is the term that we use in the field to talk about the difference between people who come from mental health services, who again have a diagnosable condition, and those that have concerns but do not. Sometimes this is even a term that's used to separate clinical psychology from counseling, right? Or from different kinds of clinical populations from each other. That if you want to work with the worried well, you might be in private practice, versus someone who doesn't want to work with the worried well would be in more of a hospital-based setting. One of the problems with the word worried well is it sends the message that this person may not actually need services, that they are well. And while that's true that they have concerns that would be of a subclinical level, that doesn't necessarily mean that their concerns are somehow not important. Just like when you struggle with something, your struggle is real to you. For example, in the back of the DSM, there's an area called other conditions or other conditions that might be a focus of clinical attention. And what these are sometimes referred to are VCodes. And they're called VCodes because the letter V precedes the number from all of them. So these are not diagnoses, but if you look at them, they are 100% the reason why many people may very much benefit from mental health services. For example, there are VCodes for surviving abuse and neglect. So if someone has had abuse and neglect in their life, either as a child and they are still a child, or as a child and they are now an adult, but they don't meet the criteria for PTSD, that doesn't mean that they might not benefit, again, from mental health services. They have a V code as opposed to a diagnostic condition. There's all sorts of things in here as well. So like, for example, having inadequate housing or homelessness. There's things like having poverty or losing your job or having a phase of life problem, being the victim of a crime, needing sex counseling, even things like having a spiritual problem or needing couples counseling or experiencing social exclusion, rejection, or some other kind of discrimination. All of these are absolutely reasons why someone might benefit from mental health counseling. So just because someone is part of the worried well, that just means that they're usually able to function on a daily basis and or that their symptoms are not severe and profound enough to meet the clinical threshold for a diagnostic condition. It doesn't mean that they will not benefit from services. So while in counseling we tend to focus on improving someone's ability to function, we also have to recognize that just because you're able to make it through the day doesn't mean that you wouldn't benefit from services, and that anyone who feels like they might need services is a worthy client to have services. And then also sometimes there might not be a presenting concern, but that person just wants to grow and develop, and we want to nurture that in them so that they can be their best person. Hopefully this helps you understand the difference between someone who may have struggles that again are legitimate and someone who has a diagnostic condition. A lot of times we refer to the things that we're struggling with as being depressed or having anxiety, but that what we're struggling with is again not severe enough to have a diagnosis, but that doesn't mean that the struggle isn't real or the symptoms are not impactful. Okay? Hope that makes sense. And again, I'll see you online.